Hey everyone, if you're there preparing for your nursing competitive exams, practical exams and so on, here I am from the team Nurses Handbook, and today I will be discussing with you about some of the very commonly used gynecological and obstetrical instruments. So let's get started. Our first instrument is uterine curette. This belongs to the category of cutting and dissecting instruments. It is used to scrape the uterine lining to diagnose or to treat abnormal bleeding or to remove the products of conception. This instrument may be sharp at both the ends or it may be sharp at one end and blunt at the another. The second instrument is vaginal speculum. This belongs to the category of retracting and exposing instruments. It is also known as duckbill speculum or bivalve speculum. It is used for vaginal examination as it helps in retracting the anterior and posterior vaginal walls. It is very commonly used in procedures like vaginal hysterectomy, vaginal curettage, for IUD insertion and in vitro fertilization, etc. Our third instrument is myoma screw. It is also known as Doyen myoma screw. It has a straight shaft with an oval handle and a corkscrew head. It is available in various sizes and is used to extract fibroids from the endometrium during myomectomy. Our fourth instrument is the Sims uterine sound. This instrument belongs to the category of probing and dilating instruments. It is also known as sound or depth gauge. Now coming to its uses, it is inserted into the cervical os to measure the depth of the uterus from the cervix to the back of the uterus or the fundus. And why there is a need to measure the length? It is to prevent perforation of the uterus while curating of the endometrial lining during D&C procedure. It is also helpful with the placement of IUDs, that is intrauterine devices. It is also helpful in verification of the intrauterine position and length for carrying out procedures like HSG, that is hysterosalpingography. Our next instrument is the Sims speculum. It falls in the category of retracting and exposing instrument. It is of two types, that is single bladed and double bladed. Here in the picture it is a double bladed speculum. At one end the blade will be narrow and the other one will be wider. It is used for examining the vagina and cervix of the patient. It is also used to carry out biopsies and in procedures like D&C, HSG, hysteroscopy, vaginal hysterectomy and colpotomy. It is also used to examine tears and in packing the uterine cavity it is used. Our next instrument is the Leach-Wilkinson's cannula. It is a straight instrument with conical tip, and this conical tip is screwed into the cervix to inject dye. It is available with and without lever lock, as you can see the difference between both the cannulas. Our next instrument is the metal urethral catheter. It is a hollow metal tube and it is used during childbirth to drain the women's bladder, especially after an epidural anesthetic. Secondly, it is used to deliver medication directly into the bladder. Coming to the next instrument is Walter female urethral sound. This instrument belongs to the category of probing and dilating instruments. It is a stainless steel tube with a narrowed curved tip and has got an oval drainage at the back. It is also known as female sounds, female dilator or urethral dilators. Now coming to its uses, it provides gradual dilation of the female urethra before the placement of cystoscope or resectoscope to ease the insertion. It is also used to obtain urine specimen or to drain the bladder. Our next instrument is Jacob's valsalon. This belongs to the category of grasping and holding instrument. It is also known as valsalon, Jacob's uterine forceps or Jacob's tenaculum. It is used for grasping the anterior lip of the cervix for manipulation, and it is commonly used during vaginal procedures such as D&C or vaginal hysterectomy. One should be cautious using this as its sharp teeth can easily puncture the gloves and skin. Coming to the last instrument, that is Hager's dilators, it falls into the category of probing and dilating instruments. It is also known as uterine dilators or cervical dilators. It is a double-ended heavy probe and it ranges from 1 to 2 mm to 17 to 18 mm of the size, with one end of the dilator larger than the other. Now coming to its uses, it is used for the progressive dilation of the cervical os for intrauterine procedures such as D&C, D&E or hysteroscopy. Thank you for watching. For more updates like this, do like, share and subscribe to our channel Nurses Handbook.